Today on Health Trust TV, we have in our studio Paul Hepfer to talk about the Health Trust Health Insurance Enrollment Services. We also visited with Dr. Ari Kriegsman, who's helping the homeless via the work of the Backpack Doctors. Elena gives us tips on basic questions we need to ask when going to the doctor, and Chef Brad Kraten from Park Place has a delicious dish made out of apples and scallops. Later, Dr. Varner tells us how to get the most from any doctor's visit, and Ryan Hughes, our fitness expert, shows us a great leg routine. All this and more on Health Trust TV. Hello everyone and welcome to Health Trust TV. I'm your host Adam Morella. Have you been to the doctor lately? If not, today you'll learn why it's important to see a doctor regularly. But first, we're delighted to have Paul Hepfer, Vice President of Programs and Director of Healthy Living at the Health Trust. He's here to tell us how to enroll in health insurance with Covered California. Hello Paul, and thank you for being with us today.
Thanks Adam, glad to be here.
Good. So Paul, how long have you been with the Health Trust and what's your primary role?
I've been with the Health Trust about 8 years now, and in my role as Vice President of Programs, I have the opportunity to oversee all of our program managers and directors of our various direct service programs like our HIV/AIDS program, our Meals on Wheels program, our Wellness Access and Education program, disease management, and our health insurance enrollment program.
That's great. So what kind of services does the Health Trust provide for people that are looking to sign up for health insurance?
For a number of years, over 10 years, we've been helping children and families with young children enroll in Healthy Family and Healthy Kids. Mm-hmm. Over the years, we've probably enrolled almost 100,000 children in Santa Clara County. And more recently, since the passage of the Affordable Care Act, we were now able to enroll adults also along with their children into Medi-Cal, expanded Medi-Cal, and the other services within Covered California.
Mm-hmm. So with the passage of Obamacare, there's so many questions. I have a list of them here for you. So first off, how do you sign up for the new Covered California? How does it work? What does the process look like? How long does it take to enroll? How long does it take to receive insurance after enrollment? Once insured, how do you select your doctor, and can I keep my old doctor?
Those are a lot of great questions and a lot of similar questions to everyone in the country has. A few quick answers for that.
Sure.
First of all, the Covered California website tries to answer most of those questions for you. So if you're really familiar with the internet and you're comfortable using it, you can go online and look at their frequently asked questions, and those are most of them.
Okay.
More specifically, if you have some troubles with the website, or if you really want to talk to a person, you can contact one of our enrollers at the Health Trust and set up an appointment, and they can really walk through the process with you.
Okay.
The average application will probably take a little more than an hour, maybe 2 hours if you have, kind of a complicated application or a lot of questions. But our enrollers are used to working with people on a one-on-one basis, and they'll take the time to really help you figure it out.
That's great. So how does someone contact the Health Trust to enroll?
If you go to the Health Trust website, we have a link to get enrolled in Covered California. You click on that link, and our phone number there, you can call and make an appointment with one of our enrollers. We have enrollers that are proficient in several different languages, and we have ways to make sure we can get an appointment for you.
And another quick question, if I have a current doctor, can I keep my old doctor as I move into new health insurance?
Most likely, yes.
Okay.
There's a few situations that people are finding where there might be some changes, but again, that's something when you're selecting a plan or your coverage, you'll be able to figure that out as you're going through the application.
Okay, and how long does it take for me to receive that insurance after I enroll?
It can be several weeks, up to 3-4 weeks in some cases. Some people are eligible for coverage almost immediately. Kind of depends on what situation you're in, but your application assister, your certified counselor will be able to help you, and you'll know when you leave there how much time to expect before you get notification of enrollment.
Okay, Paul, that's all really important information that we all really need to understand, so thank you so much for coming in today. And now we'll send you to Paloma with a field interview.
Thank you, Adam. And on today's show, I have the pleasure of being with Dr. Kriegsman from Valley Homeless Healthcare Program. Thank you for being with us, Dr. Kriegsman.
I'm happy to be here.
Can you tell us a little bit about the program?
Yeah, well, our motto is we call ourselves the safety net for the safety net. And so we tried our best to kind of reach out and find the homeless people to provide them with the health care that it's really hard for them to find in other avenues.
So how many doctors are involved in this program?
Yeah, so right now we have 5 doctors and 2 nurse practitioners. And we have 2 full-time clinics And we also have this mobile medical unit that you see behind you that goes throughout the county to try to find, again, our most vulnerable patients that we have.
How many different encampments do you visit, and how often do you visit them?
Over the past year, we've probably visited about 10 or 15 encampments. The city conducts sweeps periodically, and so the encampments are constantly shifting. But throughout the year, we've visited probably 10 to 15 different encampments. The mobile van goes to different sites throughout the county. So Tuesdays we're here, and then Wednesdays with the Reentry Center downtown, and Thursdays in Gilroy, and Mondays in the Sunnyvale Armory. And so pretty much every day of the week you can find us somewhere in the county trying to find the people who need the health care.
That's wonderful. And what kind of medical resources do you have at your disposal to treat patients at these encampments?
So we do a couple of different things. On the bus itself, it functions almost as a regular clinic. We have a Wi-Fi, so we actually hook up to electronic medical record of our hospital. And so I can prescribe medicines directly to the Violet Medical Center pharmacies throughout San Jose. And it functions mostly as a clinic, so many of the same things that you could get in a doctor's visit to a regular clinic you could do here. I can do small procedures, I can do gynecological exams. We have a refrigerator, we keep medicines, so we can give medicines, we can give vaccines here. And kind of a unique program that we have is we actually have a fair amount of medicines on site. And the idea being in taking care of homeless people, the kind of barriers that most people can cross quite easily to get their health care, being calling your doctor, making it to a visit, making to the pharmacy to pick up your prescription. These things get a lot harder for homeless people, and so we have a program here where we actually have medicines on board that we can give to people the same day that they're visiting, so we ensure that they actually get the treatment.
That's wonderful. And about how many patients would you say your organization treats annually?
I think we do something on the order of 7,000 or 8,000 visits a year.
And what type of illnesses do you see and treat?
There are some diseases that tend to cluster in the homeless population. Certain infectious diseases like HIV and hepatitis C and sexually transmitted diseases. So we definitely see a fair share of that. But mostly, I guess there's a couple other, mostly I think what we see is just normal diseases that you or I would get or anyone would get that are just way out of control. So if it's congestive heart failure or diabetes that most people are able to see a doctor for regularly and have good access to their medicines, here we have people that go for a long time without their medications and then actually just showing up much, much sicker with it. So what might just be a simple skin infection that we can take care of by keeping ourselves clean. People who live outside can't do that. And then they can't make it to see a doctor, so we see them a couple of weeks later when they have a raging infection that could have been caught at an earlier stage. And I think the more that we're here, we're able to kind of treat those things earlier on and prevent them having to go to the emergency room when they get much later. And I think another unique part of our program that we have here is any homeless population you have, you're going to see a lot of psychological, psychiatric, and mental illness and substance abuse problems. And so we actually have a psychologist who comes out with me every Tuesday morning, Dr. Preston, and so we can actually help address some of those issues out here. And I do a close consultation with the psychiatrists in our program, so we can actually prescribe psychiatric medications short term to people to help get them stabilized and in a place where they can take care of the rest of their health.
That's wonderful. How does this program receive its funding?
A couple of different streams, primarily through the county. So I'm an employee of the county and Valley Medical Center. So thankfully, we've been really well funded by the county. And we also get federal funding from the Healthcare for the Homeless, a grant through there.
Well, thank you so much for being with us today.
Thanks for having us.
And now I'll send it over to Elena for a Healthy Choice segment. Hi, I'm Elena from the Health Trust, and today I'm going to talk about getting the most out of your doctor's visit. Did you know that up to 80% of patients forget what their doctor tells them as soon as they leave the office? According to the Institute of Medicine, up to 90 million people have a hard time understanding and using their health instructions. This could lead to problems like not complying with medication, increased risk for hospitalization, or getting more care than is actually needed. You are not alone if you're having a hard time understanding your doctor. Use these Ask Me 3 questions to help you understand your health instructions. 1. What is my main problem? 2. What do I need to do? 3. Why is it important that I do this? These questions are designed to improve your health outcomes and communication with your doctor. A few more tips. Write down any questions or concerns you have before going to your doctor's visit. This will help you to remember your symptoms and stay on target during a short visit. Another tip is to ask questions. If you don't understand something, don't be afraid to ask your doctor to explain. This is particularly important with prescriptions. A great way to remember your prescriptions is to use a pill box. This is where you can put the pills that you need to take each day of the week in their day's slot. Be sure to bring your pill box as well as any prescriptions you have to your doctor so you can show them how you're managing your meds. Finally, educate yourself. Learn about your health condition. Ask your doctor where you can go to find reliable sources of information. If you're uncomfortable doing any of these by yourself, that's okay. Feel free to bring a friend or a family member with you. They can help to ask questions and remind you of what was said during the visit. Remember, it's never too early to take charge of your health. Again, I'm Elena from the Health Trust, giving you the tools to make a healthy choice.
Thank you, Elena. And coming up next, we go to the kitchen with Chef Brad Kraten from Park Place for a great apple recipe. And later on, Ryan Hughes brings us a series of leg workouts. But first, here's a healthy tip from one of our community members.
Hi, I'm Autumn Young. Did you know that keeping your hands clean is one of the most important ways to prevent the spread of infection and illness? But it only works if you wash your hands correctly. First, wet your hands with cold or warm water, apply soap, and then scrub for at least 20 seconds, about the time required to hum the Happy Birthday song twice. Be sure to wash your palms, the backs of your hands, fingers, and under your nails. Once clean, remember to rinse and dry thoroughly. For more information about good hygiene, visit www.healthtrust.org.
And we are back at Health Trust TV. Thanks for being with us. We are now ready for our cooking segment, and with us is Brad Kraten from Park Place. Thanks for being with us.
Hey, thanks for having me.
So let's get started. What will we be cooking today?
We will have seared sea scallops with apples, fennel, and an apple slaw.
Oh, great. It sounds delicious.
All right. So first we start with potatoes. So we'll do 2 potatoes. We're gonna make the puree first. Just gonna peel these. You're gonna boil them in water with a finger of ginger, which is just about this much ginger. Just peel it and then you're gonna smash it a little bit. Just
So
to,
does the ginger give it an extra flavor?
It'll give it a little extra flavor. We're going to just take it out before we put the potatoes through the food mill.
Okay.
So you say you're going to boil those potatoes?
Mm-hmm. Gonna boil them with a little bit of the ginger, just to get the ginger flavor. Okay. So we put it in there. I just want to peel the ginger. You could actually just kind of cut off the outside. You can also peel it with the back of a spoon. That way you don't waste as much of the ginger.
Oh, wow.
And it works just fine that way as well. So we're gonna cut it down and then just cut it into a couple of small pieces and then bash it with the back of the knife like that, just to get a little bit of flavor out of it.
Okay.
And you're gonna remove this too before you puree the potatoes.
So you don't puree it with the ginger?
No, you take the ginger out. You'll still get the flavor steeped in it and it won't be too strong of a ginger flavor.
Great.
So we're gonna get those boiling. And then while we do that, the other part of the puree is the fennel and onion. So we're gonna start off, we're just gonna use just half an onion so it's not too strong of an onion flavor.
Okay.
So we'll see how good your onion chopping skills are, because it takes me quite some time still to chop onion. Look at that.
Excellent.
A little bit quicker than what I do.
Yes.
I should hope so. Yeah, it was long enough. So, and about a half a bulb of fennel. Also, if the knife is sharper too, you'll have less of a tendency of your eyes watering. Because you're going through the onion without making as much
I never
juice.
knew that.
So spend money on some good knives. Huh?
Keeping a nice sharp knife will actually help you.
A good secret to know.
So the onions and the fennel will go in, a little bit of olive oil,
Okay.
and a little bit of salt and pepper.
So is this just to your taste, or is there specific amounts you want to put in there?
Just pretty much a taste, because everyone has a different amount of salt they like. This way you could adjust it yourself. Okay. So I'm gonna turn it on and do really low, because you just want to sweat it until it gets soft. Okay. You don't want to have it, you don't want any color to it, you don't want to brown it up.
Okay.
So when you're done with that, you're gonna put it through a blender, and you're gonna end up with something like that.
Okay, wow.
Okay, great.
So, and then the potatoes too, we're gonna put them through a food mill.
So how long did you say you were boiling the potatoes for? I know we're kind of...
Until they're tender when you poke them with a knife.
Oh, okay.
They just till they're tender.
Okay.
Because you want to put them through here, and this is going to help make them nice and fluffy. Not everyone has a food mill. You can actually just mash them up by hand too.
Okay.
Or they have what's called a ricer too, which is when you push it through. You use any of those.
Okay.
And you end up with that kind of consistency.
Very nice.
So you're going to mix the two.
So how long is this prep time and cook time kind of take?
The prep time is about 20 minutes, and the cook time is about 20 minutes for this part of it.
Oh, okay. So less than an hour.
Less than an hour, yeah.
Okay.
So this is what you're going to end up with. Adjust it with a little bit of salt and pepper again.
Yep.
I mean, there's some in there as well, but you want to adjust it
Okay.
to your taste, yeah.
Great.
So this is what we're cooking the scallops in, or?
This is just on the plate. This
The
is
side.
the side.
Okay.
Side dish.
Okay.
The scallops themselves are getting cooked in, they're going to get seared with coriander.
Smells good.
So you take coriander,
Oh, okay.
you're going to toast it up, get the most flavor out of it, toast it up until it's very aromatic. You don't want to brown it, you don't want to burn it, just until you get that
Just
kind
a
of
little
smell to
bit.
it.
Right.
Cool it down and then put it through a spice grinder, or you could use a mortar and pestle
Okay.
Okay.
as well. So we're going to do with the scallops, we're going to turn on the pan. You want the pan really hot.
Really hot.
You don't want to burn it.
And they're just it's a few seconds to like a minute to cook the scallops?
The
or-
scallop's going to be about 3 to 4 minutes on
Oh,
each
okay.
side.
Oh, okay.
So while we're cooking the scallops, I'll do the slaw.
Oh, okay.
Sounds good.
So a little bit of salt and pepper.
Very
And then we're going to
simple.
coat them in the coriander.
Okay, and that's going to kind of be like the crust. It's going to give it a nice crispy,
Get a nice
kind of
crispy crust to it.
Yeah, perfect. I'm excited.
That's
I'm
gonna
a-
smell
I'm a
really
scallops
good.
guy, so
Yeah.
I'm getting excited here for this one.
All right. And as we're doing this, so the rest of the fennel that you had for making the puree, you just slice it down really thin. Make the slaw for it.
Okay.
Now some people use the, if you get it with the fennel fronds on it, it's kind of nice too in the slaw. You can use those too. Makes a nice little garnish as well.
Yeah, I've never
Oh,
cooked
okay.
with fennel, so this is
Yeah.
all new to me. But this is good.
Let's use this one. So use a
apple.
Granny Smith apple, and I like to keep the skin on it because the tartness is in the skin.
Right.
Okay.
In the green apple, right?
The green apple,
Okay, that's
yeah.
what you mean by
Granny Smith, yeah.
sure.
I'm gonna slice it into what's basically batons, just like nice and thin. You could use a mandolin, like a little slicer as well, if you don't want to do it this way if you're worried about cutting yourself.
So is this a common way people prepare scallops, or I haven't seen it with the apple before?
Yeah.
I don't know if it's common, but
Yeah.
it's a pretty tasty way to do it though.
Yeah,
yeah,
sounds
great.
delicious.
Everything looks really healthy too. All these ingredients are all. We're doing all.
Is that olive oil?
Olive oil.
Olive
so you want to
oil.
use olive oil, get it really nice and hot.
Nice.
Okay.
Is that the only oil that you recommend for scallops?
Canola oil as well.
Canola oil, okay.
The smoking point on the olive oil is a little bit lower, but it's a little bit healthier. Canola oil works as well. It's got a higher smoking point. So we put the
Alright.
scallops in.
So these cook quick, right? You said just a
Yeah,
couple minutes
about
each
3
side.
or 4 minutes on each side.
Okay.
You can cook it a little more. Some people don't like it as soft on the inside.
Yeah.
Okay.
So it's more to taste.
Yeah.
Okay.
So for the slaw, a little salt. Actually, it's pepper, sorry.
Yeah,
Salt,
yeah. You gotcha.
lemon juice,
Lemon juice. So just a tad of lemon juice.
just a tad of lemon juice, and a little olive oil. A little more right here.
Starting to smell good in here.
Yeah.
Good. Here we go.
All right.
About a minute.
Ooh, that looks delicious.
Also, you want to use a dry packed scallop as opposed to something you're going to get in like the supermarket.
Okay.
Because those have a lot of water added to it. And when you cook it, all the water is going to leach out, and you're never going to get that brown, crispy, caramely crust that you're going to get from a dry packed sea scallop. Probably got to go to something like a Whole Foods or something like that. for that.
Okay. And could you pat them dry if they were packaged? Or
You can pat
don't
them dry
recommend
all
it?
day, and it's still,
Okay.
as it cooks, it's just going to leach out.
Okay.
So it's never going to be a substitute for the real deal.
Okay. That looks great.
Yeah, it smells amazing. I'm excited to taste the scallops. It's definitely one of my favorite seafoods.
The other thing I suggest too is like a cast iron pan
Okay.
or a thick bottom pan too, because you want to get it really, really hot and you want it to hold the heat. Because if you put something into like a thinner pan. As you put it in there, it's just gonna chill it down, and then you're not gonna get that same kind of crust on it. The scallops. Now we're gonna make the sauce in the pan too as well.
Okay.
So you keep the pan hot. That way you get all the bits up down from the bottom too. You get all that
So
flavor in
don't
there.
clean it out prior to making
Not
the
clean it
sauce,
out.
right? We
Sounds
want all
great.
that good stuff.
So you can add a little bit of cider.
Okay.
Oh wow, look at that.
Watch and bill.
Okay.
Finish it with a little bit of butter, just to help thicken it up. Helps in cleaning up too. You get all the burnt
There you
bits
go,
right in
yeah.
there in the sauce. Don't have to scrub as much as you normally would
Smells
have.
so
I'm up
good.
for easy cleanup, that's for sure.
And there we go.
All right, let's
There's
dig in.
scallops with the
I need a
fennel
fork.
apple
I'm gonna
slaw.
take a little bit. Here, why don't you take that fork? I'll grab my here, come on.
All right,
Break off a piece.
a big piece.
All right.
That is
Right on the money,
delicious.
Brad. Okay, so we want to thank Chef Brad from Park Place, but don't go anywhere because coming up next for our fitness segment, our fitness expert Ryan's going to take us through a really great workout routine, but before that, we're going to throw it to Dr. Varner to go over a really important health message for all of us.
Hi there, and welcome. I'm Dr. Jane Varner from the Palo Alto Medical Foundation, here with the doctor's message. Long gone are the days of the proverbial expression, take 2 aspirin and call me in the morning. Today's doctor-patient relationship is more of a partnership, and here is how you can get the most from your visit. If you are a new patient, ask your doctor about his or her philosophy of care. Be sure to communicate your needs and expectations. Don't feel shy about asking for a translator if you need one. Make it clear if you prefer to take an active role in making decisions about your care. Practically speaking, here is a list of things to bring along to your first visit. Number 1, reports of any tests that may require follow-up. Scans can be easily transferred to CDs. Number 2, reports of any major operations, and if a biopsy was done, the pathology report. Number 3, discharge summaries from any recent hospital stays. Number 4, any medications or supplements that you are currently taking. Number 5, any immunization records that you might have. Before you leave the visit, make sure that you know your options for after-hours care, such as, does your doctor offer evening or weekend office hours? How can you get medical advice after hours? What number should you call? Is there a preferred urgent care or emergency department that you should use? If you are an established patient and are coming in with a new concern, bring along as much information as you can. If you're having frequent headaches, for example, keep a headache calendar. Bring blood pressure or blood sugar readings. If you have a strange rash that seems to come and go, take a picture with your camera or smartphone so your doctor can see what you're talking about. If you're coming in for a wellness visit, contact your doctor in advance so that you can have your lab work updated prior to your visit. That way, you have some face-to-face time to discuss important issues such as cholesterol and blood sugar management. If your doctor orders additional tests such as a mammogram or colonoscopy, make sure that you are clear on how to schedule and where to go. If you're unhappy with your visit, try communicating your concerns with your doctor. We aren't perfect, and if there's something that we could be doing better to care for you, we definitely want to know. Again, I'm Dr. Jane Varner with the doctor's message.
Hi, my name is Ryan Hughes, and today we're going to train some legs. We're going to break it up into the quads, hamstrings, and get some glutes in there as well. So we're going to hit the legs from top to bottom. Let's start off with some hamstrings with a lying hamstring raise here. So what you're going to do is lay flat here on the bench, stomach down, and with this one, all we're going to do here is pull our legs to the back. Let them down and squeeze. Pulling the legs back, hitting the back of the legs here. Get a good stretch on the way down and in. Squeeze. This hits the hamstrings. It's great for building the back of the legs, tightening everything up. Pull up and squeeze. Good. Straighten it out. Pull in. Get a good squeeze. So for these, you can go 10 to 12 reps. Increase your weight as needed, and we'll get 3 to 4 sets. And again, that hits the hamstrings or the back of the legs there. Our second exercise is going to be leg extensions. This will hit the front of the legs or the quads and really helps tie in everything nice in the front. You're going to sit down, make sure the machine's properly adjusted so it fits your height needs. And all we're going to do here is opposite the last one. We're just going to pull our legs straight up. This hits the top of the legs and the fronts here. Keeps everything nice and tight. Let it down and pull up. Get a good squeeze on the top there. If you feel any kind of pain in the knees or anything, you just want to lower that weight. Up, get a good squeeze on those tops and the quads. Let it down, get a good stretch at the bottom. Up and down. On all these, you want to make sure to control the movement. You don't want to swing too much. You want to make sure that you're doing a nice slow contraction, really putting the emphasis on the legs. Our third exercise is going to be a leg press. Now the leg press can be an intimidating looking machine, but it's actually pretty straightforward. You're going to hop in the seat here. All we're going to do, put our feet up in front of us here. Make sure you're using a light weight to start just to get a feel for the movement, and you can increase from there. Push up, drop the handles here, and all we're going to do is bring the legs back down to the chest and straight up. You want to bring them just far enough to get a good stretch on the legs, but you don't want your lower back to come off the pad. So you bring it down till you get a good stretch and back up, just like that. Down, good stretch, and squeeze. This will hit the tops and the backs of the legs, the quads and the hamstrings. So it's a great overall movement for your legs, just like that. On this one, same thing, 10 to 12 reps, 3 to 4 sets of each. Make sure when you're putting it back, turn the handles in, catches the weight. And our fourth exercise, the last one we're going to demonstrate here, is pretty basic. You can actually do these anywhere. You can do them with dumbbells or a barbell or just your body weight. We're going to do a squat. So for this, you're going to go shoulder width, bend down straight, and back up. You want to go down to about a 90-degree angle on these. Nice and parallel to the floor here, and back up. And down, and back up. Keeping your knees behind your toes on the squats. Down, and back up. Good, same thing, 10 to 12 reps, 3 to 4 sets of each. So again, we hit the hamstrings first, then the quads, then we got them both here on the leg press, and finished up with the squats. My name is Ryan Hughes with Health Trust TV, reminding you to stay healthy.
Well, that's our show for today. Remember, everything you learned and more can be found on our website, www.healthtrust.org. Visit the site and join us next time as we bring Silicon Valley the latest in health. Thanks for watching Health Trust TV.